Well, good morning, and it's great to be here. Dr. Reddy, I have such admiration for him. When I met him a few years ago, he told me about his history, but also his aspirations. And creating this healthy village is something that's truly impressive. And of course, I've gotten to know Preetha and Sanjita and Sunita, and of course, you know, Sanjita, all the things you do in innovation, and Preetha, being on the Medtronic board with you has been a great learning experience for me. So what a great pleasure to be here. And I consider myself a friend, not only of Apollo, but of India and all the excitement that's going on here. So I am to speak about innovation, particularly the topic is innovation as a solution to universal access to healthcare. Now, clearly I'm framing the issue, and you already heard from Krishna Udava about what we're doing at Duke. Also, I've been very fortunate in collaboration with McKinsey and also Economic Forum in the creation of the IPIHD, which I'll talk to you about. So what I'd like to do today is actually talk about what we've learned from the organization, which is really an NGO, and how through this learning that one can look at the future steps towards creating successes in transforming healthcare through innovation. So, I think we all know the great global burden of disease, and particularly in this slide, that India in many ways leads this significant burden, both in terms of adjusted, pardon me, I'm still slightly jet lagged, in terms of looking at disproportionate illnesses that you can see on this slide. But importantly, what we're talking about today is to say, how do we bring healthcare to this very large population, not only here but globally, and looking at how do we actually achieve the affordability, the quality, and also the access to healthcare. Now, this, in fact, is a big challenge for everybody, everywhere. No single country has solved the problem. We recognize that this continues to be a problem, certainly in our country. While, in fact, quality is quite good, I think affordability is clearly a problem, and at times access is highly variable. I think we also recognize the same phenomenon going in many different countries, whether it's one or the other of the three. So consequently, it's very clear to us that we continue doing the same thing, we're not going to be able to provide that universal access to high quality and low cost care. So as Dr. Singh said, innovation has to be one of the solutions. I think innovation is a means to say we can do things differently than what we've done before. And of course, many people do innovation and create new ideas doing things when they really need to do it because they really don't have all the resources and they're able to do what they're still doing today. So in this case, innovation, I believe, is needed to drive fundamental changes in the way we deliver care, or new models of care. Disruptive technology that can help us care for patients more effectively, and importantly, as you heard from Nigel Crisp and others, training and workforce development. All these three things go together, and I believe that health systems that embrace innovation will lead and improve access, quality, and cost of care. Now, my interest in this area really didn't start with IPHD, but was greatly enhanced by my activities with World Economic Forum. Some 5-6 years ago, I led a project to ask about what are the innovators in healthcare delivery in the world. And our question in particular was asking for those who are innovatively able to reduce cost, at the same time improve quality. And because the project was very successful, and we had, in fact, Thomas Kabasi, Nico Henke as a knowledge partner from McKinsey, we decided that when we finished the project, we need to implement. And so we founded an organization called the International Partnership for Innovative healthcare delivery, or IPIHD. This entity is a not-for-profit hosted at Duke University, but it's co-founded by Duke, McKinsey, and World Economic Forum. And without questions, this is truly a partnership because it was not only the three founders, but I personally went to every CEO and every pharma device, insurance company, and foundation, and to say, you must participate in this because this is really doing good and doing well. What I mean by that, I mean that if we can find ways to support innovators and learn from them and skill replicate, we'll create a much better healthcare environment. But at the same time, for industry, by creating good healthcare, they now have channels for products to the bottom of the pyramid. And so, as you can see, we've been very lucky to have so many people supporting us. So as a starting point, this is a partnership. It's a public-private partnership in just simply asking the question, can we work with all the innovators in the globe, in the world, and see what they do, learn from them, and then help them replicate and scale, and as you heard from Dr. Krishna, also reverse innovate. So the creation of IPIHD launched at Davos 3 years ago with a vision of supporting growth of innovation through scaling and replication of those successful care delivery solutions anywhere in the world, US, UK, Africa, India, China, and elsewhere. Importantly, we want to create a platform to support the growth of these innovators so we can support them to scale and replicate. But also, we want to study and develop knowledge, that knowledge that can help influence health systems everywhere to leverage innovation. So this is a map of our network of innovators today. As you can see, there's more than 50 such networks. We have increasing number of innovators. And first, let me give credit to Krishna Uday Kumar and also Richard Bartlett for leading this organization so well. I'm very fortunate to chair this organization and being one of the original founders. But as you can see, we look at innovators everywhere, and no surprise to you, necessity is the mother of invention. When you come to countries where under-resourced, people tend to be even more innovative because in our country, people feel pretty good. Fee for service, more you do, more you pay, you get paid. But whereas you can see in the South, in particular, there's a lot of real innovators. Now I can go over many, many details, except to say, when you come to innovation, you can generally say they belong to several categories. One, of course, is business model innovation, the deployment of fundamental new models of care that fit for the evolving dynamics of the healthcare system. Second is process innovation, or some people call frugal innovation. You've heard a little bit of discussion there yesterday. Skill shifting, standardization, looking at efficiency of delivery by reallocating specific tasks or workflows to ensure that all inputs are being leveraged to maximize throughput. And the third is technology. How many people don't have a mobile phone? And how do you use this technology as a way to deliver care for patients? And of course, with the explosion of digital technology, simple or complicated, can be used effectively to manage patients at their home, away from the physicians, and away from the clinics. After all, I think most of us spend 99% of our time away from clinics, right? We spend more time at home, at work. So if we have technology that can reach people without having to come to us in clinics, you can make a greater impact much earlier. So I've listed here a number of examples. You're going to hear some of them. One Family Health, Narayana Health, Aravind and LV Prasad, particularly in India, but ClickMedics and Medical Home, some of the people are here, and I'll make sure they have a chance to discuss this. But importantly is, as an organization, we want to learn. So we go on study tours. Last October, in fact, IPIHD, together with officials from NHS, from US, from health foundations. We all went on a tour of India. As you can see that we visited a large number of these innovators. And of course, I think you should be very proud of the fact there are many innovators here, even though by statistics, they're still not enough. But they are creating lots of opportunities which are successful. Of course, I say Apollo is one of them, but Apollo is already well established. But Celia, LV Prasad, LifeSpring Hospital, I won't have time to go over this. Suffice to say, many of the successes are lean operation, standardization of protocol, and really having this great desire to cut costs and improve quality. And what impressed me greatly is the culture of these places, where every worker, if you speak to the front line, says, I'm here to reduce the cost because my neighbor needs the care, and we can't afford it. Whereas in our country, I don't think you'll find such an answer because somebody else is paying for it, the government or the employer. So the question we ask ourselves is, from all this lesson, how can we, in fact, help these innovators scale replicate? Imagine if these become adopted worldwide, or countrywide for that matter. You can really make a big difference, right? And the question, of course, is what are the challenges and barriers to scale? So very early in our initiative, we sat down and asked our innovators. And we interviewed them, we visited them, and we learned from them. And I would like you to pay attention to the right-hand column, which says there are really 4 fundamental gaps that we've identified. One is a knowledge gap, the lack of technical or medical expertise to design solutions. So you started with some good idea, then you get stuck because you don't really have the full knowledge expertise. Second is a business gap to create business and organizational expertise. Third is, of course, financing gap, to find the money, the funding, to enable to get to the next level. And of course, the regulatory gap. Every region, every country has different regulatory processes. So while something works here, you can't easily transfer over to the other side because the regulation says you cannot. I was talking to Sir Nigel Cripps about skills, right skilling, how difficult it is in our country if every state is responsible for determining who can do what and how do you get paid. But these are the 4 gaps, and because of that, we decided that we'll organize IPIHD around solutions and learning with these innovators. So we did networking and learning, creation of a network of these innovators. Everyone who joined us now becomes a network. They talk to each other, they learn from each other. We also provide annual forums of meetings, conferences for, just like Dr. Singh talked about in other areas, for these innovators to come together. Business and organization, we provide business support. This is where we are able to ask all the big farmers and industry and business who are supporting us. You should be learning from the innovators, and you can also help the innovators. And so consequently, what we've been very lucky is that many of them actually provide the business know-how, a variety of issues, from vice president onwards to help these innovators. Investment and funding. We want to connect these innovators to ways to get funding, whether it is industry or investors. And I'll say a few words about that. Then, of course, knowledge generation. At the end of the day, we can collect so much information that we can learn so that we can teach others as well as teaching ourselves. And the 5th pillar is actually regulatory. We begin to think about regulatory issues. In the Global Health Policy Summit that Aradazi organized in London during the time of Olympics, we begin to ask the question, can IPIHD also help with addressing regulatory issues? So we look at system levels as well as payers in the system and looking at asking some of the questions I won't have time to talk about. So what have we done? We have been able to do in the last 2 years, we're in our 3rd year, establish and launch a network of top innovators, sharing experience. We provided business support and capacity building. We've organized and hosted investor innovator conferences. And in fact, we're now working with Impact Fund and new funds to enable to help these innovators to invest in their opportunity. And we also disseminate the knowledge, including human capital policy, recommended for government and elsewhere. So here's an example of how active we have. You may see David Cameron in the middle of this picture. Well, he hosted, of course, the policy summit that we've been very lucky to be part of. Perhaps importantly is telling you what I think, a success story, because it's so important to tell about successes as we work in this area, because God knows there are many failures. Salo Uno, that Krishnan talked about, you'll hear some more about this. We help them, in fact, move their relevant eye model to Mexico. We catalyzed funding to about $1 million, and you'll hear different stories. Certainly One Family Health and Jacaranda both received $150,000 to expand their operations. But we also connected them with partnership. So One Family Health and GSK is working together. You'll hear from Gunther Faber later in Rwanda. And we helped Medtronic coming together with ClinMedics to create, in fact, a technology looking for otitis media and deafness. Also, we've been able to help Panda Health to create their type of HMO by having MinuteClinic, Kaiser Permanente, Cleveland Clinic to give mentor to these founders. And finally, we've been able to help Aprofi by creating not only Aetna and Sanofi, but also having one of our MBA students spend time helping them to build their program. So there's a lot of activities. I won't say that we should celebrate, but I'll say we're going really in the right direction. But let me spend the rest of my time talking about what have we learned. As I said, we learned there are 4 gaps that we can work on. But in fact, as we look at beyond an NGO, how do we actually move this forward? Actually, NGOs can be a great catalyst, but we need other parties and stakeholders to work together. So we believe that themes, which I think Thomas Kabasi is going to talk about in our panel discussion, is creating a financial buffer for innovators, mentorship and management systems, policy framework to help them integrate innovation into public health systems, and also engaging industry academia partnership to share new ideas, resources to go on with innovators, and create an innovation platform to help them reach to consumers, investors, and potential partners. In other words, there's a great need for public-private people partnership, the 4 Ps as you talk about here. Now, I made this slide in order to illustrate the point. If you look at the stakeholders, they are the innovators, of course, but we in academia, in business, and as NGO and government can all help these innovators. And I've written in this slide here 4 areas: funding, supporting innovators, building a network, and evaluating policies. I won't have time to go over each one of them. Suffice to say that we're probably going to bring this out in our conversation. First of all, in academia, well, we're always asking other people to fund us. I guess it would be hard for us to fund the innovators. However, we have intellectual capital that we can help. We can help, in fact, in education programs. We can have our MBA students working with the innovators. We can research and lead to newer ideas and frameworks. And of course, we can create knowledge that can inform policies. In the business sector, I would say business can help by mentoring, by investing. You heard from Dr. Singh about CSR. CSR is a very, I think, active area in India. CSR should look at how to help these innovators to be successful, but also create impact fund and also create collaboration and partnership. And of course, adopt the innovators themselves. Now, when it comes to NGOs, what we can do is to connect these people. We can create an alliance of business. We can help investor, innovator conferences. And therefore, what we do is we're convening. We're a platform to bring people together to support, scale, and replicate. We're a catalyst. What's been missing the table, in my opinion, is this government. If you think about this, as Dr. Singh said, private sector innovation is quite successful, but private sector innovation is not the norm if the government doesn't quite adopt it. You can't really take care of all the people through government systems, nor can you through private sector, in my opinion. There has to be a partnership. Living side by side, and I think private sector is a solution to healthcare for any country, and therefore government should adopt it. Government should provide seed funding. Government should, in fact, provide incentive for these private sectors. Government should incentivize these networks, and they should make regulatory and financial policies a lot more supportive of the innovators. So tax incentive, seed funding. In our state, in North Carolina, we have an organization called the North Carolina Biotechnology Center, on which I'm on the board. We provide loans, we provide seed grants, we have innovation funds to help private sectors, in this case biotechnology, get started. Why not in care delivery? Incentivize private sectors to adopt innovation and set up incubation hubs. I think Metro Voices Thomas may talk about, so let me not continue by simply saying there's a big role in this. So I want to finish by saying there's a need for a four-way partnership. Academia, government, business, of course, innovators, and of course, NGOs that can help, such as IPRXD. We have done well in IPRXD, as you heard from Krishnan, and we have raised money. We have been working with some government, such as in Nigeria with Mohammed Party. But now I think it's time, perhaps call to action, that in order for us to scale and replicate these very innovative ideas from the ground up, we ought to find ways to help them succeed. And in so doing, we will also create a much healthier society. Thank you very much.